Good afternoon, everyone. Hello. Thank you so much for joining us on this Thursday afternoon. As you see here today, we have Tamanna Alam, who is our intern psychotherapist, as well as a registered psychotherapist qualifying status at One Piece Therapy. And she will be presenting on unlocking connection, specifically exploring EFT, which is emotion-focused therapy, attachment styles in therapy. So those that have joined us before, whether you are attending live or watching the recorded version, thank you so much for joining. Welcome back. And those that have attended now for the very first time, thank you. And you are welcome. My name is Cassandra Francis, and I am the founder as well as the clinic director and one of the psychotherapists at One Piece Therapy. We are always so excited to give you content on your mental health, your physical health. So please do use the chat box, those that are attending live. If you have any questions, comments, please engage. And those that are watching the recorded version, as you know, we are always checking our comments. So always feel free to continue the conversation there. And if needed, we'll, set up another webinar to answer all of your questions. I also mentioned on Tuesday, during our Let's Talk Tuesday on our Instagram and YouTube live, what should we call everyone? I often just say hello. I don't know who I'm speaking to really, but one of our viewers mentioned that we should call our viewers wellness watchers. So without further ado, wellness watchers, here is Tamanna.
Hi, everyone. Thank you so much for being here today for this important and hopefully insightful presentation. So like Cassandra said, my name is Tamanna Alam, and I'm really thrilled to share with you some valuable insights that I learned from my time in training and education into emotionally focused therapy, or EFT, and how it relates to understanding attachment styles in our therapeutic work. With the agenda, so just as a brief overview of what we're going to be talking about today. So I'm going to briefly introduce what emotionally focused therapy is, which is slightly different from emotion-focused therapy, but they both go under EFT, the acronym. And then we'll overview what attachment theory is and a little bit of history and background on that. And we'll spend kind of a lot of time on exploring the four main attachment styles and the implications for those attachment styles in therapy, and how we can apply attachment theory and how we can incorporate emotionally focused therapy in our practice as well. So first, a little bit of overview of emotionally focused therapy. So it was developed by Dr. Sue Johnson, and it's a structured therapeutic approach which integrates the attachment theory with well-known systemic and humanistic methodologies of therapy that was already pre-established. So Dr. Sue Johnson and Dr. Les Greenberg both contribute to EFT, but Dr. Johnson's model, which we're going to focus on, emphasizes the attachment needs in relationships, while Dr. Greenberg's model focuses more on the emotional processing. But despite these differences, they both aim to enhance emotional connections and help clients process emotions through therapy. So EFT is built on a framework comprising of 3 stages and 9 steps, which is kind of tedious, but we'll go through them very briefly today. So with the systemic interventions, they track and restructure the interaction patterns, while the experiential part approaches or helps clients to access and process their emotions. One of the core strengths of EFT is the emphasis on establishing a collaborative therapeutic relationship. The strong alliance allows the clients to view their therapist as the safe figure or safe space, which we'll talk about a lot later. And sometimes that really helps because alliance, as we might know now, that is the strongest predictor of therapeutic success for clients. All right, so EFT also normalizes emotional responses in its core and sees emotions as adaptive and reinforces that these reactions are inherent part of being human. So the effectiveness of EFT, and when we say EFT today, we're going to be talking about emotionally focused therapy, Dr. Sue Johnson's, rather than Dr. Greenberg's emotion focused therapy, which is slightly different. So the effectiveness of EFT is supported over by 30 years of research. So it's been recognized as empirically validated approach by APA, the American Psychological Association, and EFT helps both individuals and a variation of it, EFFT, motion focused therapy, for families, also helps families and couples navigate their emotional experiences, brings awareness to their attachment needs, and this is where our exploration of attachment theory becomes essential. So, quick overview of attachment theory as well. So, it was developed by John Bowlby and expanded by Mary Ainsworth. And this theory highlights the importance of bonds formed between children and their caregivers. These early experiences significantly influence our emotional and social development throughout our lives and also affect how we connect with others in various relationships. So, a quick history lesson in the next slide. So, like I mentioned, the father of attachment theory is Dr. John Bowlby. He came up with the theory in the 1940s after observing that children who had been separated from their parents during wartime in England. So he noticed how crucial these early relationships are for a child's development, and he challenged the widely accepted idea at that time, which was Freudian view, that focused mainly on our internal psychological factors. And instead, he emphasized how our relationship with others also shape us. So, what exactly is attachment theory? Well, Bowlby suggested that children are born with an innate need for attachment. And this means they have a natural drive to seek closeness with their caregivers, usually when they're feeling scared or stressed. So imagine the system kicking in around 6 weeks of age, so very early on as a baby, and it develops over time based on how caregivers respond to the child's needs. So, according to Bowlby, when a child receives consistent and loving caregiver care, they grow up feeling secure and confident. They start to build what Bowlby called positive internal working models of themselves and others. Essentially, they learn that the world is a safe place and that it's okay to reach out to others for help when they need it. And on the flip side, if a child experiences neglect or inconsistent care, they might develop negative perceptions of themselves and others, which can lead to anxiety or avoidance in relationships. Next came Mary Ainsworth, who worked closely with Bowlby and further developed this theory with her well-known strange situation assessment. In this experiment, she observed how infants react when their mothers leave the room and then return. So this study helped identify different attachment styles based on how children interact with their caregivers. And this has been so hugely influential in understanding attachment. There's so many cute videos on YouTube that show the strange situation assessment if you want to check that out. And then Mary Main, who was a student of Mary Ainsworth, also contributed to the field in the late 1900s. And this was while studying under Ainsworth, she noticed that something critical that wasn't originally in Bowlby's theory or Ainsworth strange situation. So she recognized that there was a fourth type of attachment that was disorganized attachment. So this particular style is characterized by contradictory behaviors in children. So sometimes they're really frightened, or other times they're really trusting. And this again results from inconsistent caregiving and childhood trauma. And we'll discuss that shortly again. So the another exciting part about the attachment theory in general is that it's not just about childhood. Even though it developed from childhood, it carries into adulthood and affects how we form relationships later in life. So researchers like Mario Molkener and Philip Shaver have also focused on adult attachment, particularly in romantic relationships, and they discovered that how we were cared for as children can influence our relationship patterns as adults. Long-term studies like Minnesota Longitudinal Study also show that attachment styles established in childhood often remain stable over time. That means that those early experiences contribute to our emotional regulation and communication in adult relationships as well. So Dr. Sue Johnson recognized how crucial attachment theory is, and she brought it together with established therapeutic models to create emotionally focused therapy, EFT. And one of her notable books titled Attachment Theory in Practice, Emotionally Focused Therapy with Individuals, Couples, and Families really highlights this connection between EFT and attachment theory. In this book, she shows us how these concepts work hand in hand and promote emotional resilience and build healthier relationships.
Thank you, Tamanna. I just want to chime in here because I'm already loving the clarity and the insight that you're providing on this theory, but it also makes sense even on a practical level. Like when we're talking about emotions and being emotional beings, right? Whatever we feel something towards, we have an attachment towards, and therefore, we are attachment beings as well, right? Like whether it be a person, and it could be positive or negative emotions you feel towards them, there's still that attachment to establish. There's still that safe space, that security that you want to establish. So this was great. I just want to chime in there.
Thank you so much. I agree. It's really awesome framework to understand people. Okay, so this is the overview of the attachment styles in adult relationships, which exist on a spectrum of anxiety and avoidance. And understanding these styles can enhance our insight into how individuals connect. So let me see. So just to give you an overview of how they're categorized in two different ways, as secure attachment and insecure attachments, as well as organized attachment and disorganized attachment. So as you can see, secure attachment, think of it as like the ideal, the secure bond where all needs are met. And as adults, they feel like they can trust their partners, and we'll get into that later too. The other organized attachment are also preoccupied or anxious, dismissive or avoidant. And there is insecure attachment called disorganized, which is a bit different from what the organized ones, which we'll discuss very, very soon. Starting with secure attachment, individuals experience low anxiety and low anxiety and low avoidance, leading to open communication and emotional closeness. So as you can see, it's on a spectrum, which means they're not really discrete specifically, but they kind of go from one to the other, and people can fall anywhere in the spectrum. And this develops, all of these develop in infancy, like we said, because of caregivers and how they respond to the child's needs. For the secure attachment, infants learn to express negative emotions, knowing that they will receive comfort, and which helps them feel safe. In contrast, preoccupied attachment or anxious attachment is marked by high anxiety and low avoidance, often resulting in clingy behavior or a heavy reliance or dependence on partners or caregivers for reassurance. On the other hand, avoidant attachment exhibit low anxiety and high avoidance, leading people to be maybe shy away from emotional intimacy or serious closeness or discussions around that. And finally, the disorganized attachment or fearful attachment involves both high anxiety and high avoidance, creating a conflict within the individual between the desire of closeness, but also a fear of rejection. And we also recognize that disorganized attachment is seen in infants when they lack organized strategies for dealing with distress. So the reason it's called disorganized is because the strategy of how to deal with distress is uncertain. And this results often again from behaviors from caregiver that surround maybe ACEs, adverse childhood experiences, or unresolved trauma. So starting with secure attachment style. So individuals with a secure attachment style typically exhibit these key characteristics: that they trust others, they usually have a healthy self-esteem, and they can communicate emotions effectively. They also feel comfortable with both intimacy and independence. And secure attachment develops through 5 essential conditions during childhood. So, as Cassandra was saying, those conditions would be feeling safe. So, children need to feel safe and protected by their caregivers to trust their needs will be met during childhood. The second would be being seen and known. So, responsive caregivers who accurately interpret a child's cues foster trust and control in child. Next would be also the sense of comfort and reassurance. So when a child is experiencing distress, a caring caregiver should be there to soothe them. And when they're there to soothe them and receive the reassurance, that reinforces the secure attachment. The fourth condition is feeling valued. So, encouraging a sense of self worth by expressing joy in who that child is and not just their achievements. So, not an overemphasis on academic achievements, for example, and instead who they are as a person that nurtures healthy self esteem. Lastly, the condition for developing secure attachment is support for exploration. So, caregivers who foster independence while also providing a solid safety net. Like, I'm here for you, but you can go ahead and explore the room and come back to me. That kind of secure base, but also allowing for exploration. So there's this balance between independence and dependence on caregiver. So it's important to note that secure attachment is not about perfection, it's about consistency. It's about loving relationships that matter most. And in adulthood, secure attachment manifests as the ability to regulate emotions, maintain healthy, strong goals, and form genuine human connections. And securely attached adults generally view themselves as positive, others as positive and trustworthy, so they can easily trust their partners. They can seek emotional support as well as provide it to their partners. I really love this quote by Gibson, that securely attached adults were taught that you can be safe while being vulnerable and that their needs were worthy of being met. And that's the core idea of what secure attachment might feel like to someone.
Yeah, that is a beautiful quote. Very beautiful quote, Tamanna. Because I do agree. Yes, the word safe is often being repeated, but I do like what you emphasize of consistency, right? I know when we talk about secure, we tend to not think of the nitty gritty of what secure means, but part of the huge definitions of security is consistency. So, as a child, when your caregiver is consistently meeting your needs, there's that security. And therefore, in adulthood, there is this ability to provide that safety and consistency to others because now we're modeling what has been shown in childhood, right? I also do want to say this is more so the ideal form of attachment. It's possible, even though there is a lot of people that don't experience secure attachment. And I just want to give space to that normalizing that this is truly ideal. Not that it's impossible, but it is ideal. And I'm not sure if you are going to say this, but just in case, because when I start speaking with my clients about attachment, and I do start from secure attachment, it can feel like, oh, well, I definitely didn't have that. Like, I don't know what that's like. It wasn't consistent. It wasn't safe, and it's important to acknowledge that even though you did not experience a secure attachment in childhood, it's still possible to learn how to create a secure attachment in your adulthood. Okay? And Tamanna's already mentioned a few of what it could look like.
Absolutely, Cassandra. You're totally right about that. Even though it's the ideal, it's the rare. And it's also can be taught and not something that we were, permanently done with because of insecure attachment in childhood. We'll discuss very soon, but basically, you have the ability to turn whichever insecure attachment you might currently have into secure attachment through therapy, through work, through a very supportive partner. Things like that really, really matter to foster that secure connection as an adult. And it changes over lifespan as well, depending on the type of person you choose as your partner.
Yes, exactly. I like to insert hope, right? It's kind of like in the midst of everything, okay, let's just insert some hope and then we get back into it. So thank you, Tamanna.
Agreed. Yeah, for sure. Me too. Okay, so the next one is one of the insecure attachment styles, anxious, also known as preoccupied attachment style. So this style typically develops during early childhood due to inconsistent caregiving, leading individuals to be hypervigilant in their relationships due to a fear of abandonment. So I don't like the word symptoms so much. This is how the literature puts it, because we don't want to pathologize any of the attachment styles. It's really how they present as is what we mean by symptoms. So those would be, for example, if you notice high levels of people pleasing, a strong fear of rejection, heightened by anxiety about abandonment. Sometimes people with anxious attachment style tend to overcompensate in adult relationships. So they give and sacrifice their personal needs to maintain these connections that they see as like a source of comfort, and they really are very much like self-sacrificing. And sometimes in parenthood, anxious attachment can stem from misattuned parenting. So that means caregivers oscillate between being responsive and being neglectful. And this inconsistency can foster low self-esteem. And again, the child might cling harder to a parent who is not always there because they're worried about being abandoned. And as a child, that's like a very core fear of not being cared for. Adults exhibiting anxious attachment style often feel insecure and need that consistent reassurance from their partners. They may experience jealousy, maybe become overly focused on their relationships because they fear rejection. While the emotional highs of the connections can be really high, the accompanying anxieties can also be very turbulent. So it can very look like up and down roller coaster type of relationships. But it's also, again, very important to remember that anxious attachment style is not a mental disorder, but a very common experience. It's very common to see this type of attachment style in many adults because of their childhood experiences, which no one has control over, really. So it's very normal to feel like this fits you, but again, it's not anything to think about like something's wrong with me. It's just what it is.
Yes, thank you for saying that, because again, I'm aware when clients are or our wellness watchers engage in our content, sometimes you can go through that diagnosing piece of, is this me or this is me, and not pathologizing with the symptoms language, but signs, right? Signs to look out for, knowing that, again, this is not a mental illness or mental disorder. This is just how someone connects with other people, romantically and platonically, based on their childhood attachments. I think it's also an important thing to note too. Another sign that I've read and seen in clients when it comes to anxious preoccupied attachment is codependency in adulthood, right? Like, as you said, feeling that overcompensation, right? There's worry, there's anxiousness about rejection or abandonment. So therefore, there is this codependence of, okay, I need you there to reassure me. So something else to be mindful of.
Okay, let's look at avoidant or dismissive attachment style next. This is the one where my clients have most told me that they've been said this about themselves as an insult by a partner or someone else observing from the outside. But again, this is not meant to be an insult, a diagnosis. It's just a way of understanding our connection patterns. So this style is developed again from emotionally distant caregivers in this case, rather than inconsistent, they're just distant. So this encourages children to be independent from a very young age, but also discourages emotional expression. So again, the quote unquote symptoms as in presentation includes that they might be dismissing of emotions and appearing withdrawn. They might have difficulty seeking support from other people and really valuing independence over everything else. They might have a critical view of others, they might not, but this is again just to speak more to their independence piece. Being emotionally distant in relationships is common, struggling with intimacy sometimes, but also feeling overwhelmed if other people depend on them or they have to depend on other people. So dependency is a source of trigger. Children raised in such environments, right, where emotionally distant caregivers are there, they might seem very confident and self-reliant, but they do have difficulty forming deep connections. And then in adulthood, avoidant individuals may maintain relationships on a superficial level to protect themselves from emotional vulnerability. While they might not seek emotional closeness due to past experiences, healing is absolutely possible, again, in this case, and recognizing the desire for intimacy and learning to express their needs are key steps in developing healthier relationships for this attachment style. And emotional intimacy also just means that showing this type of clients that they may benefit from the support and sense of safety from other people. And again, it's okay to seek out help if you need for this type of attachment style. If you feel like, okay, I have been this way all my life, but I don't want to be. I want to feel connected with others on a deeper level.
Yes, a nice summary or example that I have is a client mentioned that, one of my clients mentioned she feels that she's an asshole, right? She's like some of her friends or family or even partners will say like, sometimes she's an asshole, but they know that her heart isn't, right? And I really had to share with them like, no, you're not. You're just more likely, avoidant, dismissive attachment style, right? So it's really how, as you said, we understand how to connect and not that this is a personality trait, right?
So the next one is disorganized or fearful avoidant attachment style. This one was the fourth one added by Mary Main. So this attachment style often develops from childhood trauma or abuse. So ACEs, adverse childhood experiences, where caregivers become the source of fear rather than safety. And again, the presentation of this attachment may include inconsistent behaviors, struggles with trust and intimacy, fluctuating between feeling anxious and avoidant. So if you're both and you're like, oh, it depends on the situation, this might be the type of attachment style we're looking at. Feelings of feeling very unworthy, feeling ambivalent in relationships, not really sure whether you're close or you're not really, regular shifts between being distant and being vulnerable. So a lot of inconsistencies oscillating between the two other ones we talked about, anxious and avoidant. And this, because it forms from trauma, there is also the aspect of trying to be hypervigilant over analyzing people's body language for signs of anything to do with danger or betrayal. Of course, failure to trust comes naturally with that. And disorganized attachment can be the most challenging style to manage for individuals due to the roots in fear and inconsistency, which is also, again, trauma. Adults with this attachment style might want closeness, often do want closeness, but are terrified of being hurt. And this leads to this push and pull dynamic in their relationship. and they might even expect rejection even when there is no real threat. With proper support, again, treatment, healing is absolutely possible. And recognizing this need for consistent emotional safety and working towards building trust can help individuals with this style to create healthier relationships.
And I'm not sure if you'll be getting into this as well, Tamanna, but I do want to just add in here, as much as we're identifying these attachments to be with other people, of course, it's also important to know that most people, when they have a certain attachment style, that's also how they connect with themselves. As we're talking about, fearful, avoidant attachment style, as much as there's fear to be vulnerable with other people, and therefore there's the avoidance and coping, that also is about self. Your fear to go into self and experience that vulnerability and that inner work and healing, right? So it just that point of reflection in case someone thinks. But I also know clients that they predominantly, are fearful avoidant, but sometimes they have another attachment style with another relationship. So just normalizing too that it's possible to connect in different ways with people, even though there's predominantly one that leads our closest attachments.
Exactly. Totally agree with that. And the most important part of attachment within the individual is how they regulate emotions. So that's where it becomes most important. So recognizing attachment styles in therapy can be done in various ways. So understanding can also greatly influence how we approach the client care in therapy. So let's look at a few examples of how we can recognize attachment styles in therapy. So first, let's consider the adult attachment interview, the AAI, which is a structured interview that allows us to assess individuals' attachment style by looking at their childhood experiences, asking a lot of questions about their childhood experiences, and also their current interpersonal dynamics. This was developed by Mary Main as well, and also Judith Solomon. And the AI prompts the client to reflect on their early relationship with caregivers, how these relationships shape their present patterns of attachment. I've done this with parents. When I've seen parent and child in therapy, one of the sessions would be dedicated just to do the AI with a parent. Takes approximately 1.5 to 2 hours because there is a lot of open questions for it, allowing the parent to reflect on their early childhood experiences with each caregiver. So it really gives us this plethora of information of how it was like for them in their childhood and how it might be impacting their current relationship with their children now. Next one, building on that, we have the attachment style interview, similar, ASI. This is also evidence-based, semi-structured tool. It's valuable to evaluate a client's current attachment style and assessing their support network in marital and partner relationships. So where AAI is more focused on parent-child relationship, ASI is more in romantic context or partner relationships. ASI helps us to measure ongoing support system from significant others and explore how clients form and maintain relationship and understand their attitudes towards closeness and autonomy. Another engaging method is art therapy, and that's one of my favorite tools to use with children. So one example of the assessment tool is the bird's nest activity. In this unique approach, the child is asked to create and discuss a visual representation of a bird's nest. And this exercise not only fosters creativity, but also facilitates conversation about their home life, for example, their attachment with their parent, trust, personal experiences at home. And that can also promote a lot of self-discovery and awareness. And it's such a good tool to allow children to express things rather than through words, through art. All right, the next one is just transitioning into another technique, narrative techniques. So just asking clients, encouraging them to share their personal stories about their relationships, we can maybe uncover underlying attachment themes and styles. So, for instance, asking clients to describe a specific conflict that they experienced with a partner can reveal their attachment style based on the details they share. And through ongoing discussions, we can continuously refine our understanding as the clients provide more context. So we might have a hypothesis that this client might be, for example, anxious, preoccupied attachment style. But the more information they share, more sessions we have, and the more they tell us about how each conflict went, the more we have information to either support that hypothesis or not support it. Finally, I would like to mention the experience in close relationship scale. The ECR, the short form, is the most commonly known one because it's only 12 items. So this concise self-report questionnaire consists of 12 items that assess adult attachment styles in close relationships. This specifically evaluates a maladaptive attachment behavior, particularly within romantic context, and measures them in two dimensions, the attachment anxiety and the attachment avoidance. So this allows the clients to rate their experiences on a scale of bunch of statements are given, whether they strongly agree or strongly disagree, between 1 and 7, everything in between. And at the end, they get a score that can give us like a idea of like, are they in the more attachment, anxiety, or attachment avoidance side of things. So why does this matter so much in therapy, right? As we delve into the importance of these attachment styles in therapy, it's really crucial to understand how early relationships influence not only healing, but also our ability to connect with other people. So this research paper by Geller and Ferber highlights that individuals with insecure attachment styles, like avoidant or anxious, they exhibit distinct patterns in how they perceive their therapy experiences even. So their experience with their therapist and in the therapeutic setting. Anxiously attached clients, for example, can harbor negative views about the therapy's effectiveness, doubt whether this is even useful, while avoidantly attached clients may struggle to form meaningful connections with their therapist, and therefore the alliance might not be as strong right away. This variation also underscores therapist's role as a source of a secure base, especially for those who find it challenging to trust. As therapists, we also need to be attuned to how a patient's or client's attachment style affects their engagement in therapy. So again, for another example, a care-seeking individual, which is typically anxious, preoccupied, may require more reassurance, while an avoidant style client might need more support around vulnerability to open up. By tailoring our interventions then and fostering these open discussions about their past attachment experiences, we can help shape their inner models of relationships and ultimately enhance the therapeutic alliance and hopefully promote better outcomes as well. So first off, let's talk about the secure base model, which I just introduced. It's central to this discussion. So it was developed by Gillian Schofield and Mary Beek, and it builds on the attachment theory, which we talked about. So again, John Bowlby, the father of attachment, believed that our attachment bonds are vital for emotional well-being. So basically, when we encounter distress or danger, we naturally seek out our secure base for comfort and support. As a child, that would be the caregiver. And complications arise when we don't have that secure base to return to, and that can cause psychological distress. So in therapy, we as therapists act as a secure base for our clients, providing this safe, consistent space where they feel valued and understood. So this nurturing environment then encourages clients to explore their feelings and experiences without fear. Next, we also need to keep an eye on the dynamics at play in therapy. So each client's attachment style can greatly influence how they perceive and engage in the therapeutic process. And understanding this allows us to tailor our interventions more effectively. Just like I said, insecure attachment might need reassurance and support. And secure attachment, just to say also, someone who is securely attached could be ready to tackle a deeper, more complex issues right away. So it's something we should be mindful of, that just because someone is securely attached doesn't mean there is no problems in their lives, but that they might be ready for emotional exploration right away.
I think this is a beautiful illustration of, just showing how authentic the connection is in therapy, right? Like it really, even though it's a professional relationship, it is a human connection, and we show up in various ways in session as we do in the real world, right? So it's great to know, because even how you're describing it, it's like, yeah, I do remember I will talk about things that come up live in sessions, right? But I'm also more so applying it to how the client interacts with other people predominantly, right? But again, how you show up in sessions is also fostering either insecure attachment or hopefully a secure attachment. And that can be very uncomfortable if someone hasn't experienced that attachment before either, right? But it can also be helpful in raising expectations outside of the therapy space of who are you connecting with if, you constantly do feel insecure, but have the ability to build a secure attachment.
Absolutely. And building trust is so essential in our work as well. Sorry, it was still the last slide. No worries.
Sorry about that.
It's all good. So by recognizing each client's attachment style, we can create a safer environment for them that might foster open communication and strengthen that therapeutic alliance that Cassandra was talking about. As we work together, we'll identify the patterns that come up from each client's styles, attachment styles, and these often spill over romantic relationships, friendships, family dynamics. So by exploring these patterns, we can eliminate the conflicts and challenges that they might be facing. So this is where the piece of psychoeducation is so important. If a client had no context or idea about these attachment styles, they would probably blame themselves for a lot of these things. But having this base knowledge of like how it developed and that there's hope for change would change the outlook, hopefully, or at least foster that hope within the client that this can be changed. It doesn't have to be forever. And also, as we work together, part of this process involves reflecting on past experiences, understanding these experiences to the present day challenges, and how unresolved issues from the past attachment might still affect them now. And lastly, let's not forget about emotional regulation, which is such an important piece. So many of my clients come to therapy asking for help with emotional regulation. So clients with different attachment styles have unique ways of managing their emotions. And by understanding these differences, we can also equip them with the strategies to enhance their emotional resilience as they need it for their specific attachment style. Throughout our sessions, we might also look out for potential triggers. Recognizing triggers are really vital as it helps us to emotionally navigate emotionally charged moments if they arise in therapy. And also promoting self-awareness, like I said, helping clients realize why is this the case. And by exploring attachment style, they can gain valuable insights into their past influences on their current thoughts, feelings, and behavior. Ultimately, our goal is to create a safe and supportive environment that fosters growth and development. And we want the clients to leave therapy with a renewed sense of security, a stable place in their psyche that they can return to when they're facing life's challenges. So that's us as the secure base in therapy. So the secure base model, incorporating that into our work, we're not only helping clients cultivate healthier relationships with themselves, but also empowering them to build more fulfilling relationships with those around them outside of therapy. So it's almost like the modeling that Cassandra mentioned. We learned during childhood by modeling, so why not now?
Exactly. Beautiful. It's never too late, right? Insert inspirational quote, right? It's never too late.
I love that. Quickly summarize the distinct yet interconnected roles that both the therapist and the client has in the therapeutic process. specifically through the lens of attachment styles. So starting with the therapist role, so we serve as an emotionally reliable figure, providing a secure base from which the clients can explore their feelings by facilitating the expression tailor to each client's attachment system. We can help clients navigate their emotional landscapes. And it's also essential for therapists to model healthy separation strategies. So during, let's say, at the end of treatment, guiding clients on how to manage emotional ties effectively. And lastly, maintaining appropriate boundaries is crucial to prevent clients from maybe feeling threatened, ensuring a safe environment for exploration for them as well as for ourselves. So on the other hand, the client's responsibilities are just really what we encourage them to do. It's not their job, but they're coming to therapy for something they're trying to get out of this. So we encourage them to increase the awareness that their attachment styles mean for them and how does that affect their current relationships. We encourage self-reflection, which includes examining attachment style during therapy sessions and comparing their present feelings with experiences from childhood. And clients maybe also need to recognize that those are outdated and distorted self-perceptions of themselves they formed during childhood that still influence that behavior right to this day, but don't necessarily have to anymore, and they have the choice. So this open communication about separation anxieties they might feel towards the therapist is also vital. Again, when we're either ceasing treatment or the client's moving on, it's really important that we talk through any separation anxiety that might come up and also do this in a healthy way that fosters deeper understanding and strengthens the therapeutic relationship so they don't feel abandoned when they're leaving us or going away from treatment or switching therapists even. Now let's discuss the key interventions in emotionally focused therapy, EFT, which focuses on fostering emotional processing and healthy relational patterns. So EFT has three primary objectives: assessing and reprocessing emotions, reshaping behavioral responses, and creating a secure alliance that serves as a safe haven for clients. So we'll briefly go over them in the next slide. So for empathetic attunement, it involves therapists closely observing and reflecting on the client's emotional experiences, particularly related to attachment figures. So this reflection has several purposes. So it slows down the dialogue, deepens engagement, fosters safety and positive alliance, and also affirms the client's self-worth. By distilling and organizing complex emotional experiences, clients can maybe revisit and integrate these some key milestones over time. We also want to validate the emotions. Of course, very basic in any type of therapy modality that you do is about recognizing and normalizing the emotional responses and defenses that clients use to cope with overwhelming feelings. So this, again, drawing from attachment theory, therapists can help conceptualize these responses, highlighting that patterns like fearful clinging or defensiveness may arise from insecure attachment styles. While therapist serves as an attachment figure, the primary goal is the therapeutic alliance is to explore and process the core emotions and guiding the client toward healthier relational responses. So facilitating deeper engagement involves the therapist tracking moment-to-moment dynamics and using evocative questions to encourage clients to explore both secondary and primary emotions by asking questions like, what happens to you when you talk about this? Or how do you feel in your body as you say this? Therapists can help validate these secondary emotions such as anger while uncovering primary emotions like fear of abandonment. With that, we can also have addressing emotional strategies, which focuses on recognizing both deactivating and hyperactivating strategies within attachment framework. So this means that a therapist can help manage emotional extremes by conceptualizing how clients express emotions and can use techniques like grounding techniques where clients focus on their breath or a physical sensation, which can then help foster safety. Additionally, therapists can also heighten emotion through repetition, imagery, physical responses, and allows the clients to dig deeper into their underlying feelings and the primary emotions.
Yes, and just to clarify a couple of terms here. So primary emotions are typically our core emotions, right? They're what we feel first in a given situation when we experience that trigger. And again, because emotions are innately adaptive, so they're useful. This is what makes us feel most vulnerable because it's telling us how we feel about something, right? Second, emotions are how we feel in response to our primary emotion. And here is where we might become more protective, right? If we can't feel that vulnerability of our primary emotion of fear, our secondary emotion of anger might come out. I just want to highlight that because I know often when I use these terms, clients are like, okay, what does that even mean? So wellness watchers, I got you. I got you.
Thank you, Cassandra. So last couple of ones is interpretation and conjecture involves when therapist explores deeper aspects of the client's experience that go beyond the verbal expression, beyond what they're saying. So this is not about gaining cognitive insight but rather than that, it's about fostering awareness. So for instance, a therapist might say, I notice you feel very uncomfortable during your discussion of your partner's lack of response. Could that be tied to fear? So, kind of guessing what that might be underlying. And by understanding the emotions through an attachment lens, therapists can also offer conjectures that resonate emotionally with the clients. And if you guess wrong, clients will actually correct you, and you'll get a lot of correct information in return when they do correct you. So it's okay to guess, like, could it be this? Could it be tied to this? Could it be that? And through that, we discover a lot more about clients who might not want to talk about emotions right away. And also, reframing emotions allows therapists to externalize the trauma symptoms, suggesting that they can be viewed as something like a dragon that feels overwhelming rather than a symptom to manage. So it's not about you inside something's wrong, but externalizing the factors such as feeling anger could be like seen as an external representation. And additionally, negative emotions like anger, like I was saying, can be reframed even as expressions of love that they just haven't been able to express the primary emotion for. Like Cassandra said, anger could be a secondary emotion when it might be too threatening to actually express the primary emotion, which is love. So this can highlight the partner's significance of like how they're trying to express love rather than seen as hostility. So this shift in perspective really emphasizes the potential of positive change in clients' emotional landscape. And lastly, we do this through setting up enactments.
Just going to add that, I do like your point about, suggesting emotions, right? That practitioners can suggest emotions because not only is it good to take that risk of suggesting, like, is this fear? Is this jealousy? I think it also gives space for clients to think about it, right? Otherwise, you're just talking like, this is what's going on. And you're like, okay, well, what are the feelings? And giving them space to even understand their own. So essentially, there's no real wrong in taking that risk of suggesting different emotions and interpreting that.
Lastly, the setting up of enactments, or basically we set up structured experiences where therapist leads to facilitate dialogues, either between conflicting parts of the self, if you know internal family system, IFS selves, or between clients and their attachment figures. So often using techniques like chair work, where we have an empty chair and we pretend to put a part of us in the chair and have a dialogue with it. Or let's say it's too threatening to talk to your mom or dad about something. We'll pretend to put that attachment figure on the chair and have a conversation within therapy that way. So as you can see in the picture, there's a third chair between therapist and clients typically are encouraged to face that chair and have an open dialogue. And prior to these enactments, the therapist would help the client focus on the relevant emotional experiences for clarity. So an example could be therapist asking, can you talk to that fearful part of yourself and tell her what you want to say? Or by encouraging direct communication between partners. Let's say someone who is avoidantly attached is really fearful of conflict with partner but wants to express their needs. They might want to practice it in therapy through chair work before they approach their partner. And after these enactments, clients are invited to process their experiences through an attachment lens afterwards to debrief it. And this helps them kind of extract out the meaning and integrate that new insight gained during the dialogue through chair work, for example. And that in turn hopefully deepens their emotional engagement and understanding. Okay, so lastly, there was a lot of information. To conclude our discussion, it's important to highlight how attachment theory plays a pivotal role in understanding the client's behaviors and relationships. And by integrating this theory into our practice, we can personalize our interventions for more effective outcomes. By recognize various attachment styles not only helps us enhance the therapeutic alliance, but also builds trust, enabling the clients to more freely explore their emotional experiences and past relationships in therapy. EFT, emotionally focused therapy, leverages these attachment principles to address the emotional disconnection and improve clients' dynamics within relationship with themselves, with other people, as well as with the therapist. And the framework of EFT is centered on fostering the secure emotional bonds, creating a safe space for clients to explore their vulnerabilities. Ultimately, by integrating attachment theory into our therapeutic practice, we can empower ourselves as therapists to guide clients towards healthier relationships and improved emotional regulation. And as we move forward, I encourage all of you to continue learning about attachment styles and actively applying these insights in your clinical practice and personal life. And hopefully that will also help you optimize client outcomes.
Thank you very much,
Thank you
Tamanna.
so much.
I really do appreciate how you balance out the client perspective and practitioner perspective, because I think it's so important that, as we're talking about emotions and attachments, that we really do highlight how it's about the human experience, and then understanding how we navigate our human experience. So again, we really do appreciate all those that attended today, all those that are watching our recorded version. Tamanna is accepting new clients. So those that want to continue the conversation about your attachment style or emotional regulation, and again, not only attachments with others, but even the relationship with yourself, right? So please do contact us, as you see here, support@onepiecetherapy.ca, or our phone number, and we're more than happy to connect you directly to Tamanna to begin your healing journey. Okay. Again, it's been a pleasure, and we hope everyone has a lovely rest of their day.
Thank you so much, everyone, for your time and patience. I really love that talking about this gives me so much hope and passion. So I would love to continue talking about this in therapy. And again, not to pathologize, but to understand ourselves.
Exactly. Thank you, Tamanna. Bye,
Thank you.
everyone.